For more than 2 decades in medicine, I've carried something that hasn't sat right with me. It's the kind of realization that doesn't come overnight, but builds slowly, patient by patient, year after year. And I know the moment I say it openly, some colleagues won't agree, some might even be frustrated. But staying silent would be worse. I'm Dr. Martin, and here's the uncomfortable truth. Sometimes, especially after the age of 60 or 65, doing more medical testing can actually make your health worse instead of better. Welcome to Dr. Martin Health Tips, where we focus on practical, honest advice to help you live healthier, longer, and smarter, without unnecessary fear or confusion. We've all heard the same message for years. Catch diseases early, screen for everything, stay ahead of problems. It sounds logical, responsible, even life-saving. Prevention has been drilled into us as the gold standard of health, but what often gets left out is what happens after a test finds something. Because finding something, even something harmless, can set off a chain reaction that changes your life in ways you didn't expect. This is what's known as the cascade effect. And once you understand it, it changes how you look at medical care. It usually starts innocently. You feel fine, no symptoms, no concerns. Maybe you go in for a routine check or agree to a screening just to be safe. The test comes back with a small abnormality, nothing urgent, nothing clearly dangerous, just something worth watching. But now that it's been found, it can't be ignored. Your doctor refers you to a specialist. The specialist orders more detailed tests. Those tests might still be inconclusive. Now you're looking at biopsies, procedures, maybe even surgery. Each step brings new risks, complications, infections, stress, time lost, and financial burden. And often, after all of that, the final answer is the same. It was nothing serious. It never would have harmed you. But by then, the damage is already done, not necessarily from disease, but from the process itself. Let's talk about some of the most common situations where this happens, especially in older adults. One of the biggest offenders is the rise of full-body scans, MRI or CT scans that promise to check everything at once. These are marketed as cutting-edge tools for early detection, giving you a complete picture of your internal health. On the surface, it sounds like a great idea. Who wouldn't want to catch something early? But here's what actually happens. When you scan the entire body of a healthy person over 60, you almost always find something. A small lung nodule, a kidney cyst, a liver spot. These findings are extremely common, so common that they're considered part of normal aging. The problem is, once they're found, they create uncertainty. You're told to come back in a few months for follow-up imaging. You wait, worry, and imagine worst-case scenarios. The next scan might show no change, or a slight difference that's hard to interpret. Now you're referred to a specialist. Then maybe a biopsy. And a biopsy is not a minor step. It involves needles, sometimes anesthesia, and real risks like bleeding or infection. Yet the overwhelming majority of these incidental findings never turn into anything harmful. They're simply signs of a body that has lived for decades. Studies have shown that people who undergo these scans don't live longer or avoid more diseases. What they do experience is more anxiety, more procedures, and more complications. So instead of improving health, these scans often shift focus away from what truly matters. A far better approach is to look at how your body functions. Can you move well? Do you have good energy? Is your balance steady? Are you sleeping well? These everyday indicators tell you far more about your health than a snapshot image ever could. Another common situation involves brain imaging for mild memory concerns. It's natural to notice changes as you age, forgetting names, misplacing items, walking into a room, and forgetting why. These are normal experiences, not necessarily signs of disease. But fear, especially fear of cognitive decline, drives many people to request brain scans. The issue is that brain imaging often shows changes that sound alarming but are actually typical for your age. Terms like atrophy or white matter changes can appear in reports and they sound serious. but in many cases, they simply reflect normal aging of the brain. The real danger is psychological. Once someone reads those terms, they may begin to see themselves as declining, even if their daily function is completely normal. More importantly, imaging doesn't always correlate with how the brain actually performs. Some people with concerning scans function perfectly well, while others with minimal findings may struggle. If there are concerns about memory, simple cognitive assessments are often more useful. These quick evaluations measure how your brain works in real time. And if there's an issue, many causes are treatable: medications, sleep problems, vitamin deficiencies, or mood-related conditions. Jumping straight to imaging often skips these steps and leads to unnecessary worry. Heart testing is another area where over-testing can create problems. Many older adults are sent for treadmill stress tests simply because of their age or before routine procedures. But if you're already active, walking regularly, climbing stairs, performing daily tasks without symptoms, your body is already demonstrating that your heart is functioning well. The stress test in this context may not add useful information. Instead, it can produce false positives. The test might suggest a problem that doesn't actually exist, especially since aging, medications, and other factors can affect the results. Once a test comes back abnormal, the next step is often more invasive testing, like a catheter procedure. While these procedures are valuable when truly needed, they carry risks and may ultimately reveal nothing dangerous. Meanwhile, you've been labeled with a heart condition, which can change how you see yourself. You might become more cautious, less active, even fearful of exertion, all of which can negatively impact your health. Listening to your body remains one of the most reliable indicators. If you develop symptoms like chest discomfort, unusual shortness of breath, or dizziness, those are important signals that deserve attention. But testing without symptoms often leads to unnecessary intervention. Finally, screening procedures like colonoscopies, while incredibly valuable earlier in life, require a different approach as we age. These screenings are designed to prevent disease over a long period, often many years. But as people get older, the balance between benefit and risk shifts. The preparation alone can be physically taxing. The procedure involves sedation, which carries higher risks in older adults, and complications, though rare, become more likely with age. At a certain point, especially beyond the mid-70s, the likelihood of benefiting from routine screening decreases, while the risk of harm increases. This doesn't mean ignoring your health. It means being thoughtful about how you monitor it. Paying attention to symptoms, maintaining a healthy diet, staying active, these are powerful tools that don't carry the same risks. Across all these examples, the same pattern appears. A test leads to another test, then a procedure, then potential complications. And somewhere along the way, the original goal, improving quality of life, gets lost. Health is not defined by perfect test results. It's defined by how well you live your life. Your ability to move, think, connect, and enjoy your days matters far more than any number on a report. Being proactive about your health doesn't mean saying yes to every test. It means asking questions. Why is this test being recommended? What will happen if it finds something? Will it change what we do next? Are there alternatives? These questions help you make informed decisions that align with your priorities. Medicine is powerful, but it's not without consequences. More is not always better. And sometimes the most important decision you can make is choosing not to go down a path that doesn't truly serve you. Understanding this doesn't make you neglectful. It makes you informed. And that awareness can protect not just your health, but your peace of mind and your quality of life.